Hi students, welcome to Angel Health Academy. Topic for the day is 20-point program. 20-point program. It is one of the community welfare national health program. Thank you so much for the request of the viewer regarding a 20-point program to upload a 20-point program and other national health program videos. And I also have other requests from other viewer regarding nursing service management and education or nursing administration videos. So as early possible, whenever I get time, I will try to do that video. Anyway, thank you so much for your comment. So let us move to the video 20-point program. So in the first video of my national health program, that is National Vector-Borne Disease Control Program, I have mentioned the classification of national health programs. So you can go through that, or in short in this video, I will start with that classification and I will tell you that in which area that the 20-point program is coming like that. So in India, healthcare delivery services includes various national health programs. So in the introduction part, in India, our healthcare delivery services includes hospitals, health centers, etc. Moreover, it also includes various implementation of the national health programs and other contribution from the voluntary health agency. This whole topic will come under healthcare delivery services in India. So, healthcare delivery services in India include various national health programs to promote the health and well-being of its citizens or the population. So in India, healthcare delivery services includes even national health programs to promote the health of the people and to promote the well-being of the citizen. Thus, national health programs have been launched in India by the central government for the control or eradication of both the communicable and non-communicable diseases. So many programs we have control programs, national health programs, and a few programs that is eradication programs. So control or eradication of both the communicable and non-communicable diseases, and we have other various programs that comes under the category of developmental programs, environmental development, rural development, community welfare, etc. So national health programs have been launched in India by the central government for the control or eradication of communicable and non-communicable diseases and for various other developmental programs in our country. Thus, there are three forms of national health programs in India, that is control programs, eradication programs and various developmental programs. I have made a small mnemonic here, CDE. That is not so important. You can by heart. There are control programs. Many of the programs are control programs. A few programs are eradication programs. At the same time, we have many developmental programs, community welfare and developmental or rural developmental programs. But as the study purpose, we have many programs, national health programs. So I have been classified these programs into 6 different categories. Like I have included all the communicable disease program under this category, that is communicable disease programs. Then second category, non-communicable disease programs. Third category related to MCH, maternal and child health programs. Then fourth one is nutritional programs. So D is nutritional programs. Then community welfare programs. Today we are going to discuss about 20-point programs. That is a community welfare program. I have classified a 20-point program under community welfare programs. And we have many occupational health programs. So for the easy understanding, all those national health programs can be categorized or classified into this 6 heading, that is communicable disease programs, non-communicable disease programs, MCH programs, nutritional programs, community welfare programs and occupational programs. So today we would like to discuss about 20-point programs that was started in 1975, that is comes under community welfare program. So in short, community welfare program includes a national water supply and sanitation program, accelerated rural water supply program and even urban water supply program, then minimum need program, 20-point program, national rural health mission, national urban health mission and various others community welfare programs. So let us talk in detail about today's session, that is 20-point program. So topic for the day is 20-point program, that is TPP, that is 20-point program. So introduction. The 20-point program TPP was initially launched at the first time. It was launched by the Honorable Prime Minister Indira Gandhi in 1975. So actually 20-point program initially at the first time it was launched in 1975 by our former Prime Minister Indira Gandhi. The program was first revised in 1982. Then after that this program, that is 20-point program that was launched in 1975, revised in 1982. And again it is revised in 1986. That means it was revised 2 times in 1982 and 1986. Then afterwards, over the years, the need for restructuring of this program has been felt by the government. So, need for restructuring the 20-point program were felt by the country. Then with the introduction of new policies and various programs, new programs, it has been finally restructured in 2006. So, this 20-point program TPP was finally restructured in 2006 and it has been in operation at present from 2006. So, now it is called the 20-point program 2006. So, thus the restructured program called 20-point program 2006, that is TPP 2006, that was approved by our cabinet on 5th October 2006. So, 20-point program 2006 approved by our cabinet on 5th October 2006. So, that means the TPP has been in existence for the last 30 years. So, although the TPP or even though the TPP has been in existence for the last 30 years, it is still relevant today. It is most significant today because as the desired objectives of eradication of poverty and improvement of quality of life of the common man. So, eradication of poverty and improvement in the quality of life of the common man yet to be completely attained. Still, it is not attained. It has to be or it yet to be completely attained. So, though it was present with the last 30 years, it is still relevant because the objectives of this 20-point program we are not yet completely attained. The objectives of the 20-point program we are not yet to be completely attained. So, it is very relevant and significant. 20-point programs or 20 points consist of 66 items. So, it covers 66 items and out of which the 25 items. So, out of 66, 25 items are monitored on monthly basis every month. So, 25 items monitored monthly basis and remaining items will be monitored as annual basis. As we get this information in respect of these items will be available only on annual basis by the concerned ministry. So, we will get the information from the concerned ministry regarding this remaining items only in annual basis. So, we monitor the 20-point programs in monthly basis and annual basis. So, we maintain a monthly progress report. So, as I said, monthly basis we monitor 25 programs. Then we follow the monthly progress report. In the progress report, we mention that according to the target we are achieved, very good performance and poor performance. Very good performance means the achievement is nearly 90% or more. So 90% or more target when we achieve, we call it as very good performance. Between 80% and 90% of target if we are achieved, we call it as the point is a good performance. And if the point is achieved only below 80% of the target, then we say that it is poor performance. So in the monthly progress report, we mention very good performance and poor performance based on the achievement of that particular point. If it is more than 90%, we call it is very good. If it is between 80 and 90%, we call it is good performance. And if it is less than 80% target we achieved, means we call it is a poor performance. Or we mention in the monthly progress report as very good, good or poor performance. Next is definition. So we can make a definition for this 20-point program. That is, in 1975, the government of India launched a national program called the 20-point program to create an opportunity for both political and economic development of the country. So, political development and economical development of the country, government is created a program in 1975 that was known as 20-point programs. Then later this program was restructured as 20-point program 2006, that is TPP 2006 on October 5, 2006. So this is the definition for 20-point program. Next is objectives of 20-point program. The basic objective of 20-point program are: one is to eradicate poverty from the country. So to eradicate poverty. Second objective was to improve the quality of life of a common man. That means to improve the quality of life of the poor man or the underprivileged population of the country or underdeveloped population of the country. So there are two basic objectives. One is to eradicate poverty, to remove poverty from our country. Then second one is to improve the quality of the life of the man, especially life of the poor man and underprivileged population or citizen of the country. So these are the two basic objectives of 20-point program. Next is goals of 20-point program. There are mainly 4 goals. First goal is removing social and economic disparities between the or among the people or citizen. That is removing social and economic disparities, differences. Then second one is same thing, that is eradicate poverty from the country. Eradicate poverty. And third one is raising the productivity or economic status of the country. So raising the productivity of the nation. Raising the or increasing the productivity. That is increase the national income. Then fourth one is reducing the inequalities. So reducing the inequalities between the people or among the people, like rich, poor, etc. So reducing the inequalities between the or among the people. So these are the 4 goals of 20-point program. First one is removing social and economic disparities or differences among the population or citizen. Then eradicate poverty. Then raising the total outcome or product of the country, that is raising productivity. And fourth one is, last one is reducing the inequalities among the population or between the people in the country. So next is the list of 20-point program 2006. So this is the latest 20-point program, that is 2006. When you take that previous 20-point program 1975, that will be different. Okay, so you have to study the latest one. So the list of 20-point program 2006. It includes, first one is poverty of eradication. Second one is power to people. Third one is support to farmers. Fourth one is labor welfare. Fifth one is food security. Sixth one is housing for all. That is housing for all the people in the country. Then seventh one is clean drinking water. Clean drinking water or safe drinking water. Then eighth one is health for all in the country. Health for all. Then ninth one is education for all people. Education for all. Fifth one is welfare of scheduled tribes, minorities and OBCs. So welfare of the scheduled tribes in the country, minority peoples in the country and OBC people in the country. Then 11th one is women welfare. 12th one is child welfare. 13th one is youth development, development of the youth or adolescent. Then 14th one is improvement of slums in the country, improvement of the slums. 15th one is environment protection and afforestation or deforestation. 15th one is environmental protection and afforestation. 16th one is social security. 17th one is development of rural roads. So rural roads. 18th one is energization of the rural area. So 18th one is energization of rural area. So production of electricity and energy in the rural area. 19th one is development of backward areas in the country. Development of backward areas. And last 20th one is IT enabled e-governance or e-control. So control of the population information through IT. That is IT enabled e-governance. These are the 20-point programs under 20-point program 2006. But it is remembering all these 20 program, it is quite different. So I have made a classification. I have made a mnemonic. You can apply that mnemonic and you can remember this 20 program for writing the examination. Thus, without any difficulty, you can remember all these 20 points and you can write in the examination and you can grab or score good marks. So let us see what is that classification. I have classified this list of 20-point program as for general population 11 points, For special population 5 points, and for rural and backward areas development 4 points. So you can remember that total 20 programs have been classified into 3, that is the 11 programs for the general population in the country and 5 programs only for the special group, that is special population. Then remaining 4 points is that is for the development of the rural area in the country and backward area in the country. So for the general population, I have classified 11 programs that include poverty eradication, power to people, labor welfare, food security, housing for all, clean drinking water, health for all, education for all, environmental protection and afforestation, social security and IT enabled e-governance. So this also we can study easily with a mnemonic. So the mnemonic I have made here is putting cheese on lip is healthy for all. So putting cheese on lip is healthy for all. So all will be the second mnemonic, okay, for the second classification for the special people. Now is that putting, I am taking only the P, first letter, that is P. Cheese will take CHEES but not E, okay. On we won't take, then LIP, lip. Then in healthy we take only H and for we take F. All we will continue this mnemonic for the next classification, okay. Now you know that actually there is a cheese toast, okay. Cheese can be applied on the lip, that will form a healthy lip, okay. So you can remember the mnemonic as putting cheese on lip is healthy for all. So let us expand the mnemonic. Putting P stands for poverty eradication, poverty eradication. Second, C stands for clean drinking water. So cheese, first C stands for clean drinking water. H stands for housing for all. Then first E stands for education for all. Education for all. Second E stands for environmental protection and afforestation. Environment protection and afforestation. Then SE, both together. SE stands for social security. Okay, so this is the mnemonic for putting cheese. Now lip is healthy. So L stands for labor welfare. I stands for IT enabled e-governance. P stands for power to people. Then LT, H stands for health for all. And last FOR, 4 stands for food security. So in this way you can remember the 11 points of 20-point program. The second category includes for special population, that is it includes 5 points. So for special population, that is 5 points. It includes women welfare, child welfare, youth development, welfare of scheduled tribes, minorities and OBCs, and support to farmers. So you can see that this point is related to some special group of population, that is women, child, youth, scheduled tribe, minorities and OBC, and for farmers. So you can continue the same mnemonic like putting cheese on lip is healthy for all. This all you can remember who are the people. That is all means welfare of all the people, that is for the women, that is for the child, that is for the youth. So women will produce the child will become youth, and youth may become scheduled tribes, minorities or OBC. Only for the mnemonic purpose I am explaining. Then next group is, special group is farmers. So this special population 5 points includes women welfare, child welfare, youth development, welfare of scheduled tribes, minorities and OBCs, and last one is support to farmers. The third categorization is for rural and backward areas development in the country. We have 4 points. So for rural and backward areas 4 points. So that includes improvement of slums, rural roads, development of rural roads, energization of rural areas, formation of development of energy, energization, electricity in the rural area, that is energization of rural areas, and development of backward areas, development of backward areas in the country. So you can continue the mnemonic same. Putting cheese on lip is healthy for all. I read from a book. So this is I read from a book. So I read is the mnemonic for the third group, that is for rural and backward areas. I stands for improvement of slums. Improvement of slums. R stands for rural roads. E stands for energization of rural areas. Energization for rural areas. D stands for development of backward areas. I don't have a mnemonic for from a book because it is written in a green ink. You remember only I read, because we have only 4 points are remaining out of 20 points in this category, that is for rural and backward areas. So with this mnemonic you can remember all the 20 points in the 20 point programs. So this video will be considered as the first part of the video. If you need more information regarding individual 20 points, I will make the second part in the next video. I will explain all those individual 20 points in detail. Okay. So thanks for watching. Hope this video really benefits in your studies and exam. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next and important academic video.